can begin.
Okay.
Okay.
Hello, Miss Jane. I'm going to be talking about locked-in syndrome. I don't know why I chose this. I read about it a lot in med in high school, but I just recently watched a Grey's Anatomy show, and that's where I got it from. And so, oh, I can't move it. Okay. Now, what is locked-in syndrome? Well, locked-in syndrome is a rare neurological disorder of paralysis to all voluntary muscles. This doesn't allow the patient to move their arms, legs. Sometimes it's very hard for them to breathe, or they can't breathe at all. They can't speak, swallow food or water, or they can't make facial expressions. So have you ever had like a sleep paralysis? Yes, this is exactly what it kind of is. You have your eyes open, you know what's going on, but you can't talk, or you can't move your arms or legs. And all they can do is move their eyes vertically, so they can only go up and down, and they can blink. Well, what we're looking at here is that the arrow where it's pointing to, that is a pons, and when you get damage to the pons in the brainstem, that's why it's so darkened, because of all the nerve damage to it. That's what causes locked-in syndrome. And then the second picture, well, on the first one where it says unresponsive wakefulness syndrome, this means like kind of like a vegetable state. You only have little to none brain activity. And then it shows the normal one right here. This is how much you should have of your consciousness versus the locked-in syndrome. You only have a little bit, and that's to blink and move your eyes. What causes locked-in syndrome? Locked-in syndrome can be caused by multiple things. It's caused by brain tumors, strokes, traumatic brain injuries, a disease in the blood system, infections, and it can be caused by an overdose. Even though it is caused by those things, it just has to cause damage to that pons. Signs and symptoms. Well, for one, there's no horizontal eye movement, so we can't look to our left or our right. Like I said before, you can't chew food, swallow, speak, move any sorts of muscles. And this is kind of like doctors, when they, what's the word? When they, not prescribe you, when they diagnose you with locked-in syndrome, they look for like a pseudosarcoma, which is where a patient can only respond through blinking or other eye movements. Like these men here, they had to have a surgical procedure for the tubes to be inside of their throats for them to breathe, because they couldn't breathe like other patients who've suffered from like a stroke, where they can breathe through like the nose one. Some diagnostic tests. Well, we're going to be looking at our first picture here, which is of an MRI. This looks at all the organs in the body and the bone structure. And then we're looking at our second picture, is what is a PET scan. A PET scan looks for the diseases in the body. And then our third picture is of a SPECT scan. This looks at all the blood flow to the organs. This can show strokes, stress fractures, infections, and tumors. Our last diagnostic test can be an EEG. This diagnoses brain tumors, epilepsy, head injuries, and this test confirms if the patient is brain dead. So treatment. There is no particular treatment for locked-in syndrome. The only thing you can really do for the patient is try to keep them as comfortable as possible if they do not have a good support system and they're being taken care of. But like a CNA, all a CNA can really do is give them good nutrition, find them good breathing support. They have to see a physical therapist, speech therapist, and they have to move them to prevent ulcers or blood clots. So why they see a physical therapist is because if you've ever sat in a car for like more than 3 hours, your body's sore. Imagine being like this for days or months on end. And this picture is of a man named Tony Nichols. Well, he was diagnosed with locked-in syndrome. What you see connected to him right here, and his is tucked away somewhere down there, but what you see is a device. I don't know how they have it hooked up to his blinking, but this is how he communicates with his wife and his family and his doctors. Sadly, Nick did not see a reason to live. His family wanted him here more than ever, but he just wanted to be done. And but the doctors and court system denied him. Well, Tony Nicholson did die, but he died of natural causes at the age of 58. Prognosis. Patients can get better, like I said, through their support groups or their family. It's just their encouragement that they have. The survival rate of a patient with locked-in syndrome is 80%, and they only get a 10-year span of living. Those who do not come out of a locked-in syndrome, they can develop pneumonia, skin breakdowns, and UTIs. And if you know anything about a pneumonia, it's damage to the lungs where you have a hard time breathing and it's fluid in the lungs. UTIs, if you don't treat them correctly or at all, they damage your kidneys, which can lead to kidney failure. So this is Mike. Mike was noticed by, I think it was E! News, and he was having a normal day, like normal as can be, when dropped off lunch to his wife, and then here she noticed that he was pale and sweating profusely, and then here she went home, went up to the bathroom, knocked on the door, and she knew Mike was in there, so she was like, Mike, 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 are you there? And then no answer, so she opened the door, found Mike, and he was having a stroke on the floor. And he still had a pulse, he was still there, but he was unconscious. So when he got to the hospital, the doctors did do a what is it called? A SPECT scan on him, and it showed that he did have a stroke. And so they pronounced him at first in the vegetable state. They said, if you know anything about your husband, do you know if he would want to live like this? And she said, no, my husband wouldn't want to live in a vegetable state. He wouldn't want to be put through that. And he's like, okay, well, I'll give you some time with your family, and then you can pull the plug whenever you want. Well, his daughter felt like he wasn't gone. So his daughter is like, Dad, if you can hear me, please blink. And so since one of the things that locked-in syndrome patients can do is blink their eyes. So he blinked his eyes, and that's when the doctors re-diagnosed him with locked-in syndrome. Well, with the help of his support groups and his family, he did find the encouragement to, tell himself in his brain, like, I can do this, I can come out of this. Just move little by day. He told himself, like, move your arm, move your toes. And with the help of his family, he did come out of it. And then now he uses a walker. He works out, as you can see, like he's using a exercise equipment. He drives a minivan. He works in his garage in a workshop. And like he said before, that the doctors did say that he was never going to come out of it, and that his family should just pull the plug on him. But just like Mike here, he is one of the many patients who came out of it. Professionals involved, there's neurological doctors who just deal with the brain and the nervous system. Physical therapists, like I said, they're the ones who move you around, try to get you to move and walk. Speech therapists, they help you develop a way of communication. So say if you're not really grasping the concept of blinking as a communication, they can help you. Radiologists are the ones who perform the imaging on the patient to diagnose you with diseases. And then the EEG technologists are professionals who are specialized with the EEG equipment, and they can locate brain abnormalities. And that's it.
I'm so sad they missed